Hello, I'm with Anchal here, who's going to talk to us a little bit about what health maintenance looks like for her.
Hi, I'm Anchal. I was born and brought up in Delhi, India, and I've been in Singapore for about last 10 years. So what health maintenance means to me is probably reflected by this. I just got this band 3 weeks ago, and it really helps me to track the usual things like my sleep pattern, my activities, etc. But the most interesting thing is that in the last 3 weeks, I have actually realized that when I sleep with my laptop, my sleep quality is poorer. So it's one thing reading about it in research papers, and it's one thing observing it on your own. And that thing is what is very important to me, having that data of my own health and having an understanding of how to interpret the data and how to modify my behavior to improve it. So yeah, that's an important part of what health maintenance to me is like.
Perfect. Thank you so much. And Anshul, could you tell us a little bit about your background, like where you're from and what you were doing before you came here to LBS?
Sure. I was born and brought up in Delhi, India, and I'm a doctor by training. I moved to Singapore about 10 years ago, where I've been practicing emergency medicine, and for about the last 5 years I've been working with the Ministry of Health in Singapore and looking at a lot of health policy and system planning aspects.
Thank you so much. And can you tell us a little bit about something innovative, like innovative technology or services that in the medical sphere in India that you've noticed maybe in the last few years?
Sure. So I think one of the very innovative and very helpful service that really picked up in the last few years in India is the home care services for people with terminal illness or for aging elderly. So that's something that I had a first-hand experience with my mom. She passed away 2 years ago and she had a terminal illness. But then there was this home care service, Portia, which had mobile app on which I could see the availability of all of their clinicians, nurses, therapists, etc. And I could do very easy scheduling for them to come to our house and do therapies and do nursing care for my mom. So I think that's something that is very innovative in terms of business model and how simple tech can be applied to really ease off people's caregiving burden. Yeah.
Cool. Thank you so much, Angela, for your time. We really appreciate you being here.
Thank you.
Bye.